busy. I don't ever smoke the dizzy, but we can always share some disease. It's just a cup in time. This song doesn't have to rhyme. Life's all of us, not every moment we can be feeling fine. I wanna share a moment, just a second if you will, maybe even a cup of thrill. We could share this performance. It's tea time, come sit with me.
Well, welcome guys. Miss Liz in the house. That's right. We have Dr. Laila in the house, and we're going to be talking about spine alignment tonight. That's what we're going to be talking about. We're also going to be talking about transforming, educating, aligning. And her T is refugee to doctor, root cause healer, and purpose-driven leader. That is a tea we are serving in the house tonight with Dr. Laila in the house. But before we get started, you guys know how Miss Liz rolls. Get over to Facebook, Instagram, LinkedIn, TikTok, all of those good platforms, all the podcast apps out there, and give those a like, follow, and subscribe, and get these tea times out there because they do make a difference for the guest and for somebody who resonates with the topics that we bring to the table. So let's get started with disclaimer, and then I got a beautiful intro, and we're going to get Dr. Laila in here, and we're going to spill some tea together. Disclaimer for Miss Liz's Tea Time live show. Miss Liz's Tea Time is a global platform dedicating to sharing real life stories, diverse perspectives, and meaningful conversations that inspire awareness, healing, and connection. I'm Miss Liz is going live using StreamYard. Before leaving a comment during the live broadcast, please grant StreamYard permission to display your name at StreamYard.com. Please be advised that all the content brought forward during any Tea Time show is presented in good faith. However, discussions may include opinions, beliefs, and perspectives that do not necessarily represent the views of Miss Liz or the Tea Time platform. Information shared by guests is based on their own experiences and is perceived to be accurate at the giving time of airing. All guests, viewers, and participants are responsible for using their own good judgment when considering any action or decision that may relate to these discussions. Some episodes may cover sensitive topics, including but not limited to trauma, abuse, grief, mental health, and other emotionally triggering subjects. Listeners' and viewers' discretion is strongly advised. Tea Time with Miss Liz is an open discussion forum designed to offer insight, inspire awareness, and create connection. It is not a substitute for professional, medical, legal, or therapeutical advice. If you require professional support, please seek assistance from qualified professionals or trusted resources in your area. If you have any questions regarding this disclaimer or the content of the discussion, you are welcome to contact me, aka Miss Liz, directly at my email at bookingmissliz@gmail.com, or check out my link tree at Miss Liz's Tea Time. By choosing to participate in, comment on, or view these live shows, you acknowledge and accept this disclaimer. Your participation is entirely voluntary. I, Miss Liz, welcomes you to join the conversation with an open heart, and if at any time you feel this platform is not right for you, I respect your decision and welcome you back whenever you are ready. Tea Time with Miss Liz is serving truth and awareness one cup at a time. Well, welcome to Tea Time with Miss Liz, where healing conversations meet real solutions and everyday stories remind us that our bodies and our lives deserve to be understood, not dismissed. Today's guest brings over 2 decades of experience helping people who have been told nothing is wrong or there's nothing more that they can be done. She stands in the gap between frustration and answers. Please join me in welcoming Dr. Laila Nayab-Murshidi, President and Chiropractor of Vitality Motion Center. With more than 22 years of experience, Dr. Laila specializes in uncovering the root causes of pain and dysfunction, offering non-surgical results-driven care for individuals who have often felt overlooked or misdiagnosed. From infants to athletes, from everyday strains to complex conditions, her work is centered on restoring movement, improving function, and helping people reclaim their quality of life. Her approach goes beyond treating symptoms. It is about listening deeply, understanding the body as a whole, and guiding patients towards lasting healing and vitality. So grab your cup and lean in. Today's Tea Time is about restoring trust in your body, finding answers, and discovering what true healing can look like. And let me get Dr. Laila in here and let's spill some tea. Welcome, Dr. Laila.
Hi, thank you for having me.
It is a pleasure to have you here. Dr. Laila, let's start off with who you were as a little girl and who you are now.
Gosh, who I was as a little girl. I think I was just always very adventurous, always seeking knowledge, and discovering different things. And just I already always knew from day one that I wanted to be a doctor. For the longest time, I wanted to be a dentist. And that didn't work out for all the right reasons. I believe, God has a plan, and my plan was to be a healer. And now it's not so much about my necessarily career. It's about who I am as a person. I feel like God works through me and through my hands. I'm a chiropractor, and chiro means hands. When I was little, I used to massage my aunt's shoulders and my uncle's shoulders, and they all loved it. It just came through me. I never knew at that point what chiropractic even was, but something within me felt like I needed to do something for others by way of touch or massage or whatever it was at the time.
Well, I just learned something new. Chiropractor means hands. Let's talk about the spine, because you do a lot of work with the spine alignment. What got you into the spine?
Well, actually, I had an injury myself. I had a foot injury, and I had pain in my foot. I wasn't able to walk. I was at a campus that was quite large, and walking with crutches, it was really difficult. I was late to classes. I tried everything, medicine, physical therapy, acupuncture. Nothing was helping. And then somebody recommended that I see a chiropractor. And I didn't know what chiropractic was at the time, but I was willing to try anything. And I did. When I went to see the doctor, they suggested that I take lower back x-rays. And I didn't know why, because my back didn't hurt. But they explained how the nervous system controls the extremities, the legs, essentially. The same nerves that travel to control the lower back also control the legs, and they leave between the spinal bones in the spine. And so a misalignment of a spinal bone can actually put pressure on a nerve, causing the nerve to not necessarily transmit signals properly, and as a result can cause foot pain as well as anything below the belt.
Oh, interesting. So I noticed that you use a machine in your services. I want to talk about that machine because I've never seen that machine before, and it's the Achaway heated mini scraper. What's that used for?
Oh, the Ached Away mini scraper. So that is incredible. I have to say, basically it essentially works on the tendon sheath, like on the surface of the skin, we have nerves. And so I had a patient who was not able to move a slight inch, or we couldn't even put one finger pressure on her before she would just spasm and start crying. And she was in so much pain. Nothing was helping her. She had gone to the emergency room and they gave her harsh medications. Nothing was helping her. And she wasn't sleeping, just spasming. Every small little movement was causing her to spasm. So in her case, we couldn't adjust her. We couldn't apply any pressure. We couldn't do any electrical stimulation. We couldn't do muscle work or any of the services that we have, just because she couldn't handle any slight pressure. So with scraping, you can be very much on the surface of the skin, calming down the nerves, and then essentially you can go a little bit deeper and a little bit deeper as they're able to handle a little bit more. And then when you start to actually apply more pressure, you're scraping the skin, creating friction, and as a result, heat. And so that calms down the nerves essentially, and then you're able to do a lot more for that particular patient.
So are you the only service that is doing the scraping? Because I've never seen that instrument before.
No, I believe chiropractors, some physical therapists, perhaps massage therapists, acupuncturists, It just depends on the provider and whether or not they use that modality. But usually anything to do with muscles and nerves, it's a great instrument to use.
Well, we have a couple of questions that came in for you that I want to get out to tonight during our conversation. And the first one that came in is, what inspired you to focus on the root cause healing rather than the symptom management?
I was inspired by what had happened to myself, because I firsthand experienced that it wasn't about just taking a pill or, doing some exercises. It was actually where the chiropractor that I went to initially explained how the nerves communicate through the spinal bones and control the extremities. So I could, do so many different things, but unless we actually go to the root cause, and that was the misalignment of the spinal bone that's compressing the nerve. And so if he had not done an x-ray of my back or adjusted my lower back, my foot may or may have not felt a little bit better with the work that he did on my foot, some ultrasound, electrical stimulation, some massage, but it wasn't, I truly believe it wasn't until he adjusted my lower back to remove the nerve interference that my foot started to feel better. And it was instantaneously.
And I did some research. I study a lot and research a lot on my guests. And Dr. Laila, I found that the gut and the back have a lot of alignment together, connected. How are a lot of misdiagnoses being missed because of the gut and the back?
There's first of all, the spinal nerves control the digestive system. So there's nerves that in the mid-thoracic area, for example, just T6, which is the mid-thoracic, right under the slightly above the bra line, where if we were to, and so that controls the digestive system, essentially, those nerves. And then, of course, C1, right behind your ear, one slightly inch below the ear and slightly back, that is your C1, which controls the vagus nerve. And basically that's your autonomic nervous system, which controls the gut, as well as 80% of the rest of the organs and systems of the body. So when there's a misalignment of one of the spinal bones, especially C1 and T6, that can definitely affect the digestive system and how it functions. You've heard people where they're really stressing and they feel it in the gut. And then I've read many places that 80% of digestive issues, 80% of disease starts in the gut. But that is because there's so many nerves from the vagus nerve that controls the peritoneum, the gut, the digestive system, the small intestine, the large intestine. So yeah, there's a huge connection.
Wow. Learning so much, and this is what I love about Teatime is we get a lot of education out there and we get a lot of facts and information that listeners are out there and they're saying, well, how come my gut and my back, how can that align together? So we're getting to know the back and the spine a little bit more tonight during the conversation with you, Dr. Laila. So thank you for that.
Of course. I've had patients come in with shoulder problems, and we don't just look at the shoulder. We look at the thoracic spine, because the shoulder blade and the thoracic spine and the nerves that come out of the thoracic spine controls the shoulder and the shoulder blade and all the muscles connecting and creating that motion in that whole shoulder. And so when I started adjusting the thoracic spine to help with the shoulder, they would have a less indigestion, heartburn, acid reflux. And then they're like, oh my God, I feel like I don't need to take my Rolaids or my Tums or my, those meds and stuff that create a basic environment and an alkaline environment. When the digestive system is supposed to be acidic, we don't want an alkaline environment in the digestive system, because then food doesn't get digested properly. So it's amazing and it's really interesting, and most people don't realize, but just slouching and having bad posture, and as we age we start to get weaker muscles, and it's so imperative and so important to stabilize your foundation, because your pelvis dictates your how you maintain your form, and your pelvis tilting forward or back is directly related to whether or not you have flat feet, or you have pronation, or you have where you're rolling in. People that roll in, they start to lock their knees, and then their pelvis tilts forward, and then when you have tilting of the pelvis forward, you start to round your back and shoulders. So that kind of starts that whole cascade of effects, and people don't even realize that it stems from the feet and also their pelvis.
Wow. So I know that you also work on animals as well as people.
Well, I started out just adjusting my little Bentley, God bless him, and he's in doggy heaven. And he was 14 when he passed, just like 9 months ago. But yeah, I was adjusting him because sometimes he would have that little shakes and little shiver. I don't know if he ate something, or something just didn't agree with him. So I would adjust him with an activator, his mid-thoracic area, and literally within a few seconds, he would stop shivering and he would be totally fine. That's how it started out. But then I had patients here and there asking me, because we have like a close connection. I don't actually treat animals, but I've had patients who would ask me, and if they were okay with it, then we did a light adjustment. I don't have formal training on treating animals, but all I'm doing is really stimulating the spine and the nervous system by using a light device called an activator, which I use on post-operative patients, as well as newborn babies, as well as somebody who is apprehensive. And it just taps the bone lightly, creating proprioception stimulation. So, and it's a very light adjustment, but it definitely helps.
And how young is your youngest patient you've had?
3 days old.
Oh. And they were in there for the back or the feet? What were they in there for?
The 3 days old was actually my own daughter, and my pediatrician recommended that I adjust her because she wasn't sleeping. I had a home birth, and she would sleep for 30 minutes and then wake up in 30 minutes increments. And I was like a zombie because I hadn't slept for 3 days. I had a home birth. It was beautiful and natural, and it was amazing. I was up and walking that same night, and the next morning I took my dog for a walk. But she wasn't sleeping, so she's like, "You're a chiropractor. Why don't you adjust her?" I adjusted her with an activator. I adjusted her atlas. After about 10 seconds, she went to deep sleep for 7 hours straight. It was incredible. Yeah. And but I've had, maybe a week-old baby for torticollis, where their neck was kind of stuck and dislodged, and their arm was kind of limp, and they were not moving their arm. For projectile vomiting, colic, ear infections, constipation is a big one for kids, and just crying with no reason, as well as foot drop, where they were dragging their foot and not able to pick it up and position it properly. And so those are the ones just off the top of my head, but we treat for many different things. But just sometimes just wellness, patients who get regular adjustments, they would bring in their new babies to come and get checked out. Even one of my colleagues who's a chiropractor, she didn't want to adjust her own baby, and the baby was I would say probably about 30 a month old, and she brought him in to get him checked out and also to get him adjusted. I think from what I remember, his head was always turned to one side, and she was just wondering why he's not turning to the left, and after an adjustment he was turning both ways equally.
Wow. Another question we had that came in for you, Dr. Laila, is how does your whole body alignment impact emotional health?
Gosh, that's a great question. I mean, everything is connected. If you're not functioning well, you're just not happy. The emotions are completely tied to that. Um, our nervous system is like a circuit board. Our upper cervical spine is like our motherboard. It's like a computer. All of our cranial nerves pass through there. So yes, absolutely. I've had patients who are just always in a hunched position. As they slouch in a hunched position, that's also kind of like a depressive type of posture, right? You've seen most patients that are depressed, or they tend to have this type of slouch where they're just like that mindset. Obviously, that kind of posture affects the body. And when the body is affected, the mind is affected and the emotions affected. It's all interconnected. Doesn't matter which comes first, but one thing, when one thing goes, it all gets affected. And that's why when somebody tells me, oh, I have a herniated disc, my MRI shows that I have a herniated disc, is that where my pain is coming from? Not necessarily, because it could be something above and below that segment. Because when one thing goes, you want to treat everything, not just the disc. You want to treat the muscle. You want to treat the spinal bones. You want to treat the foundation, the posture, how they sit, how they carry themselves, as well as, of course, the disc itself.
Wow. And what misconception do people have about chiropractor care?
That it's for pain. Pain is just a signal that your body's giving you that it's had it, that there's a problem that needs to be corrected. And it's not just, only address your symptoms when you have symptoms. You don't, floss your teeth and brush your teeth and go in for cleanings when you have pain in your tooth. You do that preventatively, to prevent and to be proactive so that you can minimize decay in your teeth. Just like tartar builds up on teeth, calcium builds up on the spine, especially where we have more stress because of misalignment, because of tight muscles, because of weak muscles, because of bad posture. And so we want to minimize that calcium buildup on the holes where the nerves are coming out from, because then that's going to create encroachment and compress the nerve. And as a result, the nerve is not able to transmit signals properly, and we get a bad signal. And then we wonder why different parts of our body is dysfunctioning, and then we resort to medication to suppress those symptoms, but we're not treating the root cause.
So what causes a calcium on the back?
So usually it stems from, let's just say, you can say bad posture, weak muscles, tight muscles, genetics, a fall, an injury, a flat feet, one leg shorter than the other. So those types of things can actually cause a shift in the spine, a misalignment of a spinal bone. So sometimes people say, I pulled the muscle, but where are you pulling the muscle from? The muscle has an attachment. So if a muscle is pulled, it shortens. When it shortens, it pulls the bone out of alignment, compressing the nerve. And as a result, that's where we get the actual pain. And so, so what we want to do is look at, the whole picture, and not just, through a small hole, but really look at the whole picture and align the spine. Because now you can, I'm so sorry, I was going on a tangent a little bit. Can you repeat your question?
Where were we? The calcium on the back.
Yes, I'm so sorry. Yes.
I spaced out too. I was just like, what?
So the calcium, so basically those are the things that cause the misalignment or the tight muscles, which limits the blood flow and nutrients and oxygen. So what happens when an area doesn't get oxygen, doesn't get blood flow? Blood is food and nutrients to the nerve, to the joint, to the body, to the organs. Without it, we wouldn't be able to live. And so when an area, when a spinal bone is out of alignment, the muscles around it get tight. it lacks blood flow. And then as a result, you have more wear and tear. So there's more stress on that area. And as a result, your body says, well, this is so tight and restricted. Let's just fuse it to the one above and the one below. So what it does is deposits calcium as if it's fixing a broken bone. What happens when we have a broken bone? Your body naturally deposits calcium in that area, in that in the crack or in the fracture, and to mend it together, to fuse it, because it's thinking that it's going to stabilize that particular bone that's broken. So when we have a misaligned bone, the body goes through a process of trying to mend that. And as a result, it goes through some bone remodeling. And because it's trying to stabilize, and it creates the calcium buildup. And as a result, those bone spurs form, and it's trying to fuse to the one above and the one below, like a natural fusion. But not necessarily is that a good thing, because then it's going to, encroach the nerves.
So how is the back and the teeth aligned? Because you said calcium on the teeth, calcium on the back. So is there some kind of connected and understanding? Because you wanted to be a dentist when you were a little girl. So like, were you curious about the calcium buildups?
Well, definitely, just like tartar builds up on the teeth. It's just natural. It's just the way our bodies function. Obviously, we're using a lot of motion and movement and stress to the joints, stress to the teeth and the gums, as well as, of course, any type of oxidation, any type of food particles that are in and around the teeth. So we want to make sure that we clean that area. We make sure that we have good stabilization of the muscles that are called muscles of mastication, basically those muscles that open and close the mouth. And obviously, just like wear and tear, if you don't align your tires, your tires are the car is still drivable, just like your body is still functional if you don't get alignment, but it's just going to wear down a lot faster, just like the tires will bald and wear down faster. There's more wear and tear when there's lack of blood flow and nutrients and oxygen, and as a result, we're working tight muscles to just do our daily activities. And when we're younger, we're obviously just running. My son runs from one room to another, but we tend to be more sedentary. So we lack blood flow and lack nutrients. Things get tighter, and so then we have more wear and tear. And then calcium builds up on the spine because it's acting like as if it's trying to help us by anchoring the bones, by creating those bone spurs to essentially have that bone remodeling to essentially fuse those bones. And fusion by any means, whether surgery or surgical fusion or a natural fusion, is not necessarily a good thing, except when we have a broken bone.
There's so much we're learning tonight about the compression, the alignment, the back. What body is the most movement, the back or the jaw?
Gosh, I would say, honestly, I don't know exactly, but I think both, because I would say I would say the jaw, because we're constantly talking and we're constantly eating. And even when we're sleeping, we're breathing. And so we're more laying down, I guess. And so the back is not moving that much. We're still, but the respiration and the muscles are constantly, allowing us to, even when our bodies are relaxed, I would think that the mouth and the jaw, and there's some maybe minor movements, but usually because we're talking and eating on the daily, breathing. So I think probably the jaw.
It just hit me. I was like, I wonder what moves more, the jaw or the back?
Yeah,
we're up, we're down, we're sitting, we're walking, we're steady, moving around.
I guess when somebody throws their back out, that's when they realize how much they use their back muscles and their back for everything. When you do an ab workout and you get a little sore, even the minor little movements that you make, then you're like, oh my gosh, We use our abdominal muscles so much. Or even when we have an injury to the pinky and you're like, gosh, I don't feel like I would use that pinky so much, until you actually are not able to use it. So and then you realize. So when patients come in for a car accident and I show them their x-rays, sometimes they see things on the x-ray that they didn't realize that they had these issues. And so they always say the accident was a blessing in disguise, because now they're able to see all these issues that they had that they didn't even realize, because they never had x-rays done until they had that car accident. And they were able to see the lack of curvature in the neck and the arthritis that was building up in the spine because of that lack of curvature. And from that accident, they were able to see and what needed to be done. So while we treat them to get them to pre-injury status where they're not in so much pain, after we discharge them for that case, they want to do corrective care, because that is accessible and possible. Not only do doctor means teacher, so essentially it's my job to teach my patients how to become self-sufficient so that they can do for themselves and not be completely dependent. It definitely is a lifestyle. And the more knowledge you have about what your spine looks like, and a little bit about your muscles, which ones are weak, which ones are tight, then you have a good starting point to work towards bettering your health by stabilizing your infrastructure, and that's your muscles as well as your spine, which encases your nervous system, your spinal cord, as well as your nerves. So if you have strong muscles and flexibility and good curves in your spine, then overall your function is going to be optimal. Absolutely.
Dr. Laila, do you know anything about the CSF blockage and leakage?
Not so much as far as blockage or leakage. I mean, obviously with the spina bifida occult, I believe there's a leakage of a cerebral spinal fluid. What I know is that as we walk with our pelvis tilting forward, when we engage in our gait cycle, as we're walking forward, the pelvis tilts side, the sacrum tilts side to side. As it tilts, it's actually pumping cerebral spinal fluid to the spinal cord. And so we need that fluid. Just like we have blood pressure, we also have pressure in the spinal cord that's caused by this by the fluid that's inside the spinal cord, the cerebral spinal fluid. And so it's important for mobilization and for that sacrum to be tilting back and forth. So when we're misaligned, that sacrum is locked up on one side. It may or may not give you symptoms. Again, people wait for pain to really do something about it. But if you're restricted in that pelvis area that's causing restriction on one side of the sacrum, then you'll see people start to kind of like have a shift in their gait. They're still walking, they're still functional, but just not optimal and proper. And as a result, that may affect even the cerebral spinal, the pumping process of the cerebral spinal fluid. But I haven't done research to that degree to be able to really talk on it at right now, and don't want to give misinformation. But for sure, the nervous system controls the brain and the spinal cord itself, and C1 in the C1 nerve affects the vagus nerve, affects the cranial nerves, and that also affects the brain. So when that C1 is out of alignment, you can get ADD, ADHD, anxiety, depression, nervousness, migraines. You can get vertigo, you can get headaches, high blood pressure, and of course, it affects the autonomic nervous system, which is essentially your organs. So it even affects the colon, and that is just being misaligned in the upper cervical spine.
Well, thank
But
you for that
you definitely
information.
want to see someone who is experienced in adjusting the upper cervical spine, because if somebody is susceptible to having a stroke because they have a small space where the vertebral artery passes through, and just going and getting their head washed at the hairdresser and being in that position for a long time can actually cause them perhaps maybe to have minimize that space and put pressure on the vertebral artery and can cause a stroke, for example. So if somebody's predisposed or susceptible to having that, even a small whiplash, or one of their friends, and kids do this sometimes where they push each other, that can cause them to have a little bit of a whiplash, and as a result can cause pressure on the vertebral artery and can cause a transischemic attack, which is a small stroke. But so it's critical and important for patients who do go in for headaches and who do go in for vertigo and who go in for high blood pressure or different or even neck pain, and that you go see a doctor who does a vertebral basilar insufficiency test to make sure that you're not susceptible to getting injured. So doing a proper adjustment is critical, but also testing before you do an upper cervical spine adjustment to make sure that it's safe.
Well, thank you for that. The reason that I'm asking is because I've been diagnosed, I've been told that I have CSF blockage. Now, could that be caused from an accident, car accident from years prior? Or?
Did they tell you where the blockage is at?
No, they haven't found where the block is yet.
Interesting. And have you had chiropractic care throughout your life? You had. Interesting. Your question, yes, it can happen due to trauma. Anything can happen through trauma, accidents, a whiplash. I'm just curious as to see where they're saying the blockage is at. And as a result, what kind of symptoms are you having as a result?
Limping, trouble walking, trouble urinating, severe headaches.
Oh, wow. Okay. So that could be upper cervical as well as in the mid lumbar area as well, because that controls, your bladder as well as reproductive organs, as well as the knee and the hip. So I would address upper cervical spine as well as the lumbar area. Did they also indicate that you have a herniated disc that's compressing upon the spinal cord in that, well, at level of L3 or level of L1 and below L2, you don't have the spinal cord anymore. It's the spinal nerves that are still being affected. But I would be curious to see if you have an MRI or a CT scan.
Yeah, I'm scheduled for one. I just haven't been called for one yet.
Okay. Yeah, that should give you some more information. It's the more pieces of the puzzle. Absolutely. I'm curious how they already said that without diagnostic testing.
Yeah, they're sending me for a bunch of tests, but I just wanted to bring it up because we were talking about the spine, and I did some research, and it's a spinal fluid. So how important is the spinal fluid?
Oh, critical. We would not live without it.
So
Absolutely.
does that affect the calcium buildup in the back, or?
I don't know what the direct relationship would be, or perhaps maybe indirectly. I would think that the calcium buildup in the spine can cause instability of that particular vertebra, and as a result, the disc can herniate and then compress and put pressure on the spinal cord and the essentially minimizing or creating blockage of the cerebral spinal fluid. But that's just somewhat indirectly. Yeah. But I wouldn't know if it would be directly related to that.
Well, Dr. Laila, you do a lumbar decompression. What is that exactly?
Spinal decompression is good for the neck as well as for the lower back. And basically, when our discs herniate out of alignment, or when there's degeneration of the disc is 70-80% water and about 20 to 30% fiber cartilage. And the cartilage is like our nose and our ear. It's a tough substance that keeps that globular mass of water inside, that is like inside like a little gel. And so it allows us to be able to, have this kind of motion in our spine, because that disc fulfills two functions. One, it acts as a spacer, and one, it acts as shock absorption. And so when we start to lose water from the disc, then the disc is not able to fulfill its function of being a spacer or a shock absorber. So what the spinal decompression will do is it actually allows for process of imbibition, which allows the discs to reabsorb the water that it's lost, to and perhaps maybe not complete all of what it's lost, but to some degree some. And so it creates some spacing. So when you pulled, we put a belt around the patient's waist, we hook them up to the machine, and there's other parts that are held inside the machine, and then the two vertebrae essentially are pulled apart. And so when you pull them apart and you hold them for about 45 seconds, the disc is able to reabsorb the water that it's lost. And as a result, it creates space. And so it takes the pressure off the nerve. So it's the non-surgical solution to stenosis, which means narrowing of the canals where the nerves travel, herniated discs, as well as degenerated discs. So when discs are herniated, they're moved out of space. So what we want to do is create a negative vacuum effect like this, and it sucks the disc material back in. And that process of that pumping action, it's amazing. And unfortunately, the FDA doesn't approve it, so insurance doesn't cover it. It's out of pocket, because just like vitamins, I guess the FDA does not approve it, but nonetheless, it works. It works. I would really go that route before considering permanent injury, like surgery. But you have to see if you're a good candidate for it.
Well, how has your personal journey shaped your clinical philosophy?
Well, just going through, I guess in my country, even though I was very young, everything was so organic, and it was a different lifestyle. We came here, we didn't know what bologna was, and Wonder Bread and all those things, because we ate so much more organic and natural. I think when we came here, my father was 42 years old at the time, and he had a heart attack. And so he was really into natural healing, and had books that he was reading, and always was more into natural things. And that really, I would say, affected all of us. And so it had a lot to do with how we were brought up and what we were exposed to. I don't have any medicine in my house. When the kids were little, I would have some Tylenol, baby Tylenol, just in case if they had a fever when they were teething. But we rarely used it. If they had an ear infection, I would put garlic oil in their ear, and that really fixed the problem. It was always like remedies that we had at home. I would make a concoction of garlic, ginger, apple cider vinegar, lemon juice, and honey, and I would have it in the refrigerator and blended. So when on the daily, I would say probably I would have it daily, just because I was around a lot of patients and they would breathe on me. And so I wanted to make sure that not only was I getting adjusted regularly myself to boost my immune system and have good functioning of my nervous system and body, I would also have things like that to just build my immune system and have a stronger immune system. But I would also give it to the kids ever since they were little, ever since they were allowed to have honey. And then and they're used to having it, and they're used to the taste, but that would, prevent them from getting sick. But if they had a little cough or a little sniffly or anything, I would give them that, and they were rarely sick, knock on wood.
So you originally come from Galveston, correct?
Afghanistan.
Could you tell us one memory that you have as a little girl that you love about the country?
Oh my gosh. So there's so much. It would be a whole book. I really need to just write a book.
That's coming next. She'll be back on Tea Time with her book.
Yes, I actually have a book that's almost done. It's about whole body health, which is more about how to improve and better your health and lifestyle. And so that's almost done, but just my background and history from Afghanistan. What I remember, I would say a couple of things. One, we had cows, we had goats, we had birds, we had different chickens. And so um, we had our own milk, we had our own eggs. So it was very like, how should I say, more like a farm to table type of food. And so that I remember. And then there were certain foods that I didn't like. And because our neighbors were my grandparents and my uncles and my aunts, you could just open the door and to the side gate, and then you would end up in their yard. They're all connected and we're very close. And I would just take my dish and then we would do a swap. If they made something else, then I would swap my food for what they would have. And that, and then I think when we escaped from Afghanistan during the war, I remember that, and we were riding on donkeys, and we went overnight, like 3-4 o'clock in the morning, and we went and escaped to Pakistan. And I remember that because we also have pictures that we took on a small camera. And it's interesting enough, even though it was like a long time ago, but it was color pictures, and that we printed and we still have. And I could put that in my book too. That's great.
This is why you came to Tea Time.
It was such an adventure. It was so fun, going through the little rivers and waterways and over the hills, riding donkeys, wearing different clothing than what we're used to, because we lived in the capital in Kabul. So we dressed conservatively, but obviously similar to what we wear here, jeans and a t-shirt, But when we dressed as if we're going to a wedding overnight, and we had the rice and oil, like we're going to a wedding, a family member's wedding, by the border. We dressed like they do in more rural areas. And so we were more dressed like that. And my mom had the cover and all that stuff. So it was scary, but I was a kid. I didn't know any better. Now that I hear stories about what my parents were feeling and how scared they were, that if they were caught, we would all go back and get executed. But we made it.
Have you ever gone back home?
I have not. I would love to. My sister-in-law goes back often, and I would love to go one of these days. But I still have young kids, so they need their mama. So one of these days, I'd love to.
I always like to bring in the different countries, because so many people they hear the horror stories, right? The war story. And then they don't think of the people that lived there and had these special moments where, where the family was connected, where you just opened the gate and grandma and grandpa and aunts and uncles were down there. And I hear that a lot about the different countries, the connection, the family connection. Do you find that connection is like that in the US and Canada as well? Because I'm in Canada. I know you're in the US. Do you find that connection is there?
Within our family, or within, in general, the population that live here? I would say, obviously, because in Afghanistan, one person can work, and that could provide for the whole family. Here, both mom and dad have to work. And in addition to work and lifestyle, sometimes we get inundated with work, and busy with the kids. And, the kids, we used to have a driver, and, we used to have somebody who, lived on the grounds and would help us with cleaning and cooking and driving. Here we have to do everything ourselves, which is obviously fine, but we have to make time for it. I was just with my family this weekend. We had our Eid celebration, which is after 30 days of Ramadan. We celebrate for 3 days. And so Friday, it was just me, my husband, and the kids. Saturday, I was with my in-laws and spending time with my mother-in-law, and who I adore, and my in-laws. And then on Sunday, I was with my family. And so we make an effort, even though there was a distance I had to drive down an hour and a half to be with them, but it was absolutely worth it. So I think that it just depends on the family. One of the biggest thing that my father instilled in all of us, he said that he would completely cut off ties with us if we had any type of dispute that we didn't resolve amongst our siblings. So we're always very much connected, and our kids are very connected, and it just depends on, I think, the family and making the effort and time.
The reason I asked that, Dr. Laila, is because I seen a video where you said you have to make time for yourself as well, right? You're a businesswoman, you're a mother, you do a lot of work in the community and that as well. So how do you find time for yourself?
I think that just like they say, if you don't on a plane, if you don't put your own mask first and then your children's mask, and then if something happens to you, what good are you going to be for anybody else? So it's really important for me because I practice what I preach. I make sure that I make time to exercise. And I feel like that is like my sanctuary, and my if I feel like I need to make time to be strong physically, because I lift and I'm adjusting patients that are sometimes heavy. Even the small ones tend to be tight and rigid, and that puts a lot of stress on my body. So I have to practice what I preach, but I feel like it's so important to meditate. It's so important to have that mindset to really be there for yourself, and focus on things that are going to definitely benefit your mind and your body and your soul. It's not just exercising. It's really a combination of all of that. And so that way you can be strong, you can be physically fit, you can, be healthy and not let the stress of life get to you. So it's important, especially if you're being a role model for your kids as well. You want to make sure that you're practicing what you're preaching to everyone. So if I expect my son to sit upright or my daughter to sit upright when they're working on their homework, then I have to make sure that I'm not slouching. And if I hold them accountable to avoid foods that have additives, then I have to make sure that I follow and the same guidelines for myself as well.
And we talked about that this afternoon with Dr. Ron as well, is being the example, right, for our grandchildren, our children, the people that are watching. If we want them to be a certain way, we have to be that example first. We have to lead the way,
100%.
And
So true.
So Dr. Laila, how does your faith influence your leadership and service?
Gosh, I feel that God is such a huge part of our lives. My father and my grandparents, they've always taught us from early on, and we grew up in a family that was very much about honesty, gratitude, giving. So important that once, that a certain portion of your income should go towards charity, to help the needy. It's actually, there's research now that when you give, you actually have some healing effects. And so I think that's huge in our family, and my kids are all about it. We discuss it. I think that it really helps me to be connected to God, which I feel like God is in my heart. There's that little voice that sometimes we have to shut down, because that little voice, we might think that that's us, but sometimes it isn't. So having faith and having God near and close and connected, you can really shut down that little voice that might be somewhat evil acting, or sometimes that is not necessarily you, but can take you in the wrong direction if you really listen and not have that faith. For me, I think that's really important, and it's made an impact in my life as well as my family.
And Dr. Laila, how is God and the back connected?
God and the back? Gosh, that's an interesting one. I think that, how should I, in my opinion, obviously, because I haven't really researched this, gosh, I think that God really works through us. There's just that instinctively we're made such that we always want to try to be there for others and help others. And I feel like that's God within us. And I think that if the nervous system is, if our body is functioning well, if our nervous system is functioning well, we have that ability to connect with our subconscious and ability to connect with our brain. And I feel like the brain is still very difficult to really understand how it functions. I think that humans are just tapping into what's going on now with AI and what's available to us. But I feel like that is the hardest part of the body to really understand as humans, with all the research that has been done. And I feel like there's that connection that between the brain and God, and that obviously higher power, whatever most people want to call it. And that's why when somebody transcends, when they do that yoga, where they do yoga and then they are able to transcend, I feel like there is a huge connection spiritually between the body and the spine and God.
The reason I asked that question is because of the spinal fluid going from the back to the brain, right?
Mm-hmm.
It's that juice of life. Without the spinal fluid, you said we wouldn't be able to survive. So without the juice of God, we wouldn't be able to be here.
Absolutely. 100%. Yes, absolutely. Very true. I mean, God made us. So, we're made by that higher power, and how we evolve and from a cell, and so it's of course that there is that huge connection. Absolutely, I believe it. I think I was just trying too hard to connect it scientifically.
I knew you understood it. There was just, sometimes we just overthink things.
Yeah.
And it's right there, right?
Yeah.
So before we wrap up, I want to just get into the name of your business. If you could just read out the website for the audio listeners out there, and for anybody that'll catch the replay, how can they reach out to you and what services do you offer?
So our website is Tustin, TUSTIN VMC. That's VictorMaryCharlie.com. And you can find me on TikTok, on YouTube, as well as Instagram. It's under Body Work Doc. So that's body, just like work, WRK, and then DOC. On Facebook, I believe it's Vitality M Center. And as far as services, spinal decompression, we talked about that, of course. Spinal alignment, adjusting the spine, chiropractic. We do scraping, we do deep muscle work, we do functional training. We teach you how to take care of yourself better, as well as cupping, which is amazing. I love cupping. I'm all about.
We didn't even get it, cupping. We got to get you back for cupping.
Oh, cupping is amazing. I can answer a couple questions on that if you like. And then custom-made orthotics for the feet. So if you're flat-footed or you pronate or supinate, your feet is your foundation. If your feet is your foundation and you're the house. So if your feet is not how it should be, then the house is in trouble. So it's those are the types of things that we actually do, and some products and excuse me.
Well, Dr. Laila, if you want to go a couple minutes over, we can talk about cupping for a bit. I'd like to get that in because then we can get some more information out there for anybody that doesn't know what cupping is. So if you'd like to just share about that really quickly, and then we'll wrap up.
Sorry, I think I'm in the wrong pipe. I have some oregano oil in there. Oregano oil is antifungal, antimicrobial, and antiviral. So I put a couple of drops in my water every so often. So you have to be careful if you don't have a gallbladder and you're not emulsifying fat properly, then it wouldn't be such a good idea. But a couple times a week, I'll put 1 or 2 drops in my water because I come across a lot of patients, like I said earlier. But let's talk about cupping. Cupping is, just an ancient type of work that has been done for years. Excuse me. Basically, we use cupping that creates suction, and it sucks oxygenated blood to the surface of the tissue. We put it over tight muscles, muscles that is lacking blood flow, or there's trigger points, or a muscle that's spasmed. And ultimately, we're bringing new fresh blood to that area, which promotes healing and regeneration of new tissue, essentially. So it calls your body's natural stem cells to come and repair and regenerate that problem area. So we create that suction and that blood flow into that area to essentially heal and increase blood flow. So wherever there's more blood, there's more circulation and there's more fluid motion, and then the muscles start to lengthen and they start to heal. And when the muscles lengthen, they release the joint and the joint moves better, and then you have more space for the nerve, and then the nerve transmits signals better to the organ and systems of the body, and you have better healing. It's amazing.
So what is cupping used for mostly? Is it for accidents or?
I would say tight muscles.
Muscles?
Restricted muscles, spasm muscles, tight muscles, dysfunctioning of any type of muscle, or even an injury, for example. Because a lot of times when somebody's injured and they injure a tendon or sprain even a ligament, and that doesn't happen by itself. Obviously, the muscle's involved too. So if you can release the muscle, then it's going to, help get more motion in the joint and more motion in the ligament or tendon as well. So I think that it can benefit a lot of different type of symptoms, whether it's tennis elbow or golfer's elbow or tendonitis or knee problems or osteoarthritis, essentially. Osteoarthritis, for example, in the knee is caused from wear and tear, but also from improper tracking of the knee or the pelvis, and so if you treat the muscles, then perhaps you can get a little bit better tracking and a little bit more motion and movement and even strength in the muscles that affect the knee. So that could be one of the adjunct to all the other therapies that can benefit someone who has osteoarthritis and they don't want to take medication.
Oh, cool. Well, thank you for sharing all of that and spending some extra minutes with me. What final message would you have for all the listeners tonight?
Don't wait for pain. Get your body checked out, and an ounce of prevention is better than a pound of cure. And so if you can just get checked out, whether or not you have pain, and do some minor tweaks that can really stabilize your infrastructure, and so you can have optimal health.
Well, thank you so much, Dr. Laila, for joining me tonight. And I really appreciated this and taking the time to help me as well with my questions and that as well. So thank you for that. Thank you
And
to all the listeners.
And we didn't practice our questions. You were very prompt too. It was fun.
7 years, 7 years of doing this, and I always learn something new. So thank you so much for joining me. I'm just going to do a wrap up of what tonight's tea time was, and we'll be back on Thursday with 2 new tea times. What an empowering and insightful conversation. Dr. Laila, thank you for reminding us that pain is not something we are meant to simply live with. It is communication. It is the body asking to be heard, understood, and supported. Tonight, we were reminded that healing is possible when we look beyond the surface and take the time to understand the root cause. Your work shows that when care is intentional and personalized, real change can happen. To everyone listening, here is something to carry with you after this tea time. If something in your body does not feel right, do not ignore it. Your body is speaking and it deserves to be listened to. Until our next cup, share, keep choosing your health, keep seeking answers, and keep believing that your well-being matters. And I'll see you guys on Thursday, and we'll do this all over again.
Thank you.